It's such a pleasure to be talking today at this really exciting webinar. It's a very tough act to follow coming after Sir Jeremy Farrar, but I will try my best to keep you informed of what's happening in India, at least in terms of trying to advance the field of One Health. So I'll start my presentation now. I'm just going to share my screen. I'm a fellow at the Ashoka Trust for Research in Ecology and Environment, and I'm also a fellow of the DBT Wellcome Trust India Alliance program. So in today's talk, I will be talking about One Health surveillance systems to better understand the risk of zoonotic diseases in India. As we know that the world is, of course, suffering from the effects of COVID and is under COVID-19 under its shadow, and we've gone through some pretty surreal times. Empty cities, shopping malls emptied of their most pressing resources. In India, we've had some really trying times, and have witnessed a humanitarian crisis. One of the largest migrations of people moving back to their hometowns, walking for hundreds of kilometers, often without food and water, all because of the disaster that has struck us. Okay, but this, as Sir Jeremy just mentioned earlier, this is not something that we haven't received warnings about. In fact, we were told pretty often and very clearly that we should be looking out for the next big one. And this pandemic had been warned of decades ago. So why were we left so unprepared? And how is it that scientists came to know about these things? Now, some of this has already been mentioned, but I'll go over it again. As has been evidenced, coronavirus, the COVID-19 or SARS-CoV-2 is a zoonosis, and it's a class of various other zoonoses or emerging zoonotic viruses that can emerge from a wildlife host population, and they can emerge either directly through transmission to domestic animals or via a vector interface. And as the circulation goes on again via a domestic animal interface, which often acts as an amplifying host, it can then spill over to humans and result in outbreaks, potentially to pandemic levels. Okay, these are of course not the only reasons for the emergence itself can happen, but as you know, but the sorry. Just trying to. I'm not able to animate my slides for some reason. Oh well. As we've seen this dynamic can be quite complex. As we've seen with the coronavirus group of viruses itself. I mean, look at the diversity of different species that can potentially play host to these viruses, as well as the groups of species that can play a role in the transmission of these viruses or other pathogens, other such pathogens to humans. So there's absolutely little comfort to draw from this. In fact, an analysis was done a few years ago that showed that tropical areas around the world were most at risk of these emerging and re-emerging infectious diseases. And one of the reasons for this is that especially countries like India, as you can see from this map here, countries like India and China and other parts of South and Southeast Asia are really hotspots for the risk of emerging diseases. The reason for this is that three things seem to come together. They are biodiversity hotspots, so obviously the diversity of life is high in these areas. They also happen to be human population density hotspots. Of course, I mean, India and China are the most populous countries in the world, and they also have very high numbers of livestock. Okay, so when you put that together, you find that the conditions are right for the emergence of zoonosis in these kinds of areas. Um, so let's talk about one of the oldest zoonoses known to man. This is rabies. Rabies has been around for a very long time. We've known about rabies for a very long time. In fact, one of the earliest descriptions, written descriptions of rabies, comes from the Samhita Sushruta, which was an ancient Indian text written written several thousand years ago, at least a couple thousand years ago. We can see that that map that I showed earlier finds close mirror in this map as well. India is also amongst the countries with the highest risk of rabies, or actually the highest number of rabies cases in the world. We have the dubious distinction of leading the world in the number of human rabies deaths every year. We have about 20,000 human rabies deaths and contribute about 30% of the world's rabies burden. More than 95% of this comes from domestic dogs. And as we know, there are lots of dogs in India. There's about 60 million dogs in India, and there's about 20 million dog bite cases reported every year. So if you did a quick search of what rabies looks like in dogs, you'll find images like this. But I'm going to show you that this may not necessarily be true. So as you can see from this video, this is typically what you'd expect a rabid animal to look like. But you could also have very friendly, normal, nippy pups that one would never guess were rabid. You could have animals that look very, very sick, of course. Okay. Or you could come across a dog that looked like this walking around on the street. And you wouldn't associate this animal with rabies. But of course, all of these are rabid animals, as is this pet dog that's been brought in. It's a black Labrador brought in somebody's car. You can see there's something off. The tongue is dirty. It's got lockjaw, and that's another symptom of rabies. Now, rabies is a very dangerous disease. It's 100% fatal if you contract it, and there is no cure for it. But it's very easily vaccine preventable. And the world has come together to try and eliminate rabies. So the goal is that by 2030, we can have zero rabies. And so there are many different organizations have come together, including the World Health Organization, the OIE, and so on. And the goal is and they formed this Global Alliance for Rabies Control. And the goal is zero rabies by 2030. And one of the ways of achieving this goal is by mass vaccination of domestic dogs. So the strategy is that if you vaccinate annually about 70% of the dog population in any given area, then you will eliminate canine rabies, and therefore also reduce the chances of human rabies occurring in this area. Now in India, we have a large population of free-ranging dogs that are unowned. So it requires a lot of effort to try and catch these animals. And therefore, India has more or less failed to control rabies. One of the ways of achieving a good outcome for rabies control is supposed to be through the OneHealth framework, using the OneHealth framework. Now, what is OneHealth? Basically, it's a mechanism where you view, or it's a framework where health is viewed in a holistic manner. Basically, it recognizes that environmental health, animal health, and human health are all interconnected, and that people who work in these different spheres need to come together, especially in the case of zoonosis, to better understand the risks that these kinds of diseases pose to all of these different sectors. So a OneHealth, for instance, a OneHealth surveillance strategy would include monitoring wildlife health, livestock health, as well as human health. So I'm going to give you an example of what kind of surveillance we're talking about. Now, surveillance in India, especially for rabies, is really poorly done. I mean, we have very little um, uh, proper techniques or mechanisms for surveillance in India. So through my Wellcome Trust funded project, well, India Alliance funded project, I partnered with an organization in Pune city called the Rescue Charitable Trust, who work with street animals, who pick up animals in distress, bring them over. They have an excellent team spread across the city, and they have an interface that allows people to report. So when animals were brought in, and if they were suspected to be rabid, especially dogs, we would test them post-mortem. We would also first test them ante-mortem, that is, before they died, we'd take a saliva sample, and after they died, we'd take a brain sample to test for rabies. Okay. And what we found was rather startling. And I'm showing you just 1 year's results, but we've got results over the last 3 years. You know, before this, people hadn't realized how common rabies was, even in a city like Pune. Okay, and this is a city which has had a vaccination program run for a very long time. And over just 1 year, we were able to find we had more than 360 cases of reported suspected rabies cases, with 160 of those testing positive for rabies. Now, as we know, and as I already mentioned, dogs are the primary reservoir of rabies. So it's important to understand the ecology of dogs. What are they doing? What are their populations like? What is their movement like? How does rabies spread between populations? So what we did is we used some wildlife techniques to try and understand the ecology of dogs. We put GPS collars on them to try and monitor their movement. So as you can see here, there's a bunch of dogs. Each of those dots is an individual dog, and you can see them moving around. You can see that there's a small number of dogs in the center which are in a village. Okay, and I'll show you a little bit further by zooming in. They move far less than the ones on the periphery. And these movement rates and contact rates are important for us to use to understand how rabies can spread in such landscapes. But dogs are not the only species out there that can carry rabies or that can spread rabies. There are also lots of wildlife in these areas, things like jackals, foxes, jungle cats. So what we did was we also monitored, let me show that to you again. So we also monitored jackals, jungle cats, foxes in these regions to look at how these species might potentially overlap and interact with domestic dogs. And we then wanted to put all of this together. So this is a conceptual model that we put together to try and see how rabies might spread from urban areas through a peri-urban link population to rural sink populations, and what role wildlife might play in the spread or in the maintenance of rabies in these areas. We've also used some genomic techniques to do some phylogenetic constructions for some of the samples that we've obtained, and we're getting some really interesting early results. So this shows that there are several variants of rabies virus, several that are circulating within even just one city. Okay, several strains of them, and some of these are have been there for quite a long time. Okay. We are also able to use this genomic sequences to look at transmission chains. So we can see both short transmission chains, close in time and close in distance, as well as long transmission chains, both in time and in distance. Okay. And then once you start building these kinds of data, so both the movement data as well as these kinds of prevalence data, you can then start parameterizing models such as this. So this is an agent-based model that we developed to look at dog populations and how different interventions can reduce both the populations as well as increase vaccination coverage in them. Okay, and you can run several simulation scenarios on this. So let's step back out again to So what we need to do, or what we need to look at in terms of the risk of zoonosis and who does it affect the most. So if you look at this map, you can see that um, if you overlay poverty, global poverty, and the likely zoonosis hotspots, you again find a massive correlation. So the greatest burden of zoonosis is concentrated on poor tropical communities. And it's these areas that really lack a mechanistic or better understanding of these changing disease burdens. And some of these things can then hamper the decision support tools needed to inform mitigation. I'll give you an example of the kind of disjointed uh, efforts that governments often put in place to address some of these challenges. So this is a network map of different ministries in India. So we have veterinary health that's overseen by different. So we have two areas that are two different groups of ministries in India or institutions in India that are looking at veterinary health. One is the Ministry of Fisheries, Animal Husbandry and Dairying, and the other is the Ministry of Agriculture, with its partners or its institutions, the ICAR and their institutions. Then, of course, we have the public health sphere managed by the Ministry of Health and Family Welfare. Wildlife health is managed by the Ministry of Environment, Forests and Climate Change. And then, of course, there's the Ministry of Science and Technology, which tries to provide scientific inputs. You can see that some of these are well connected internally, but it's the links between them that are really missing. And this is what we need to build if we want to have a better One Health system. So we need to have groups working together. And in an Indian context, and indeed in a global context, it's very difficult to get groups to work together across ministries unless there is a lot of funding in place, unless there's a framework in place, there's a mechanism in place, or there is a sort of supra-ministerial level coordination cell in place. Okay, we are hoping that some of this will change going forward with the announcement of the National Mission on Biodiversity and Human Wellbeing. And as the finance minister also recently announced, there is an increasing emphasis on One Health, and there's the plans for setting up of a One Health Institute. But this is a new national mission on biodiversity and human well-being announced by the government of India. And this is being supported by the PSA's office, the PM stack, and will be led by the National Biodiversity Authority. The precursor to this has been led by what's called the Biodiversity Collaborative. It's a group of scientists working together to come up with this framing. So this program has several different, or this mission has several different programs, an important part of which will be looking at the linkages between biodiversity and health. Component of which, of course, will be biodiversity and zoonosis. The aim of this sub-program, the One Health and Zoonosis sub-program, will be to operationalize a One Health framework in India to interrupt the emergence of novel and infectious diseases. It will do this through examining the relationships between changing land use patterns, biodiversity loss, and zoonotic disease. It will map or help map novel and re-emerging infectious diseases and initiate a network of sentinel surveillance sites across India for doing this this exercise. This is what a potential map of sentinel surveillance sites across India could look like. These are biogeographically representative. They are also coupled with existing facilities such as virus research diagnostic laboratories, zoos, research institutions, and so on. So we really hope that these will be hubs where integrated sampling can happen across the human, domestic, animal, wildlife interface. And they can be developed as state-of-the-art training and research facilities. We hope that this program will enhance regional surveillance capacity. And all of this will be done through a large grants program, which will emphasize with a massive focus on team science. So we've proposed that this won't be individual grants, but rather be team grants to to bring together interdisciplinary, or to bring together teams from different disciplines to work together in an interdisciplinary manner. And if any of what I've said here does not make sense, then I urge you to watch John Oliver's show on this. This show is on YouTube, and he does a fantastic job in a 20-minute segment of covering virtually everything all of us have spoken about. And of course, he does it with humor and some profanity. So there's an alert for that. I will end my talk here. Thank you very much for listening. And I'll end with this last slide. Thank you.